Good afternoon, everybody. I'm David Baiada, the CEO here at Baiada Home Healthcare. Today is Friday, May 14th, and this is your weekly COVID-19 update. I'm going to jump right in as usual here with Nora Triola, our Chief Clinical Officer. And we're going to talk first and primarily about vaccines, but first about our recently introduced Paid Vaccination Leave Program. This is a really important recognition of the time you're spending to set aside the necessary logistical complexity to find your spot and get your shot. We're going to be compensating every single Baiada employee $50 per shot. So if it's a J&J shot, it's $50. If it's one of the other two manufacturers, it's a total of $100 across your two shots. And this is for everybody, including those that have had their vaccination previously before we announced this program. As long as you get your shot, your second dose, as long as you have your first dose before June 30th, you're eligible for this compensation. So, this is the other thing, really important nuance is that in order to be eligible, you've got to upload your vaccination card into Workday. If you're not sure how to do it, reach out to your manager, reach out to your friends. We have gotten some questions about how to navigate Workday. It's really easy once someone shows it to you. For many, it's self-explanatory, but make sure you find your spot, get your shot, upload your card, and get your compensation. You can see here the cutoff dates in the table at the bottom for your vaccination card uploading. With that, I'm going to turn it over to Nora to address a very common question and anxiety out there for our employees related to vaccinations.
Thanks, David. And really neat to know that our organization is going to recognize the time, either personal time or work time, that each of our employees use to go get vaccinated. And for some of you that are still thinking about it and are thinking about how this actually affects any kind of fertility issues, we wanted to provide some best evidence that is available from the CDC and some of the manufacturers of the vaccines. Large studies now of over 30,000 really have identified that there is no current evidence that any vaccine, including COVID-19 vaccines, cause any kind of fertility issues. So again, if you're pregnant and you need to really think about the likelihood of your succumbing to COVID-19, and we know that the seriousness of the illness, both for you and your unborn baby, are significant. And so if you are pregnant, the recommendation is clearly that you should and can receive safely the COVID-19 vaccine during that pregnancy to protect, again, that severe illness. No hospitalizations, no deaths. You may have loss of taste or smell, but you'll recover. And that's the big key point here if you're pregnant. If you're trying to become pregnant or you plan on becoming pregnant in the future, really, again, the literature is amassing itself to suggest that there is no current evidence anywhere that vaccines could cause infertility or fertility problems when you try to get pregnant. So the CDC is coming out saying, you don't need to avoid the vaccine, you should get the vaccine, and we'll continue to study this and update you as the data continues to amass itself. But right now, and I think for the foreseeable future, the vaccine has been proven to be highly effective and very, very safe. So over 270 million doses given across the country, and here's one of our own. This is a beautiful story. I think Kelsey is telling, us, and what better message than one of our own telling us that, she chose to get vaccinated. And I want to read her quote because I think it's really important to recognize that she, like some of you, I'm sure, felt hesitant about getting vaccinated while pregnant, based on very strong suggestion of her doctor, who advised that the threat of preterm labor, hospitalization, and other side effects, if she got COVID-19 while pregnant, were far riskier for her than being vaccinated. After she looked at months of research and the confidence booster from her pregnant friends and family, she did the same. She decided to go ahead and get vaccinated during her second trimester, to both protect her baby, her health, and the health of her family. So beautifully said, Kelsey, for the message that you send to others who are trying to become pregnant or are pregnant. We thank you. And again, thanks to all those who have researched it and carefully thought about it, gone ahead and gotten vaccinated. If you have questions, send them in. We'll be happy to answer. But vaccination's safe and effective. And so we hope you all move forward in that process.
Thanks to Kelsey for sharing your story. And thanks, Nora, for continuing to give us confidence in what the research is helping prove so that we can feel safe as we navigate hopefully the home stretch here of this pandemic. We'll see you next week.